right, we're going to go ahead and jump right in here. So good morning, good afternoon, wherever you may be joining us from. My name is Grace Rubenstein, Editorial and Communications Director with HealthBegins. It is my honor to welcome you today, along with HealthBegins and Elevance, to our webinar, Advancing Health Equity Effectively with the Social Needs Investment Lab. So before we start, just a few things for you to note about how this is going to work. This webinar is going to be recorded, and don't worry, you don't have to write everything down. We'll be sharing the recording and the slides with you at the end of the webinar. Also, your lines are on mute today, but we do want to hear what questions you have. So if you have a question for us, please feel free to enter it at any time in the Q&A window. If you look down at the bottom of your screen, you will see there among the icons a question mark box. That's our Q&A box. You may enter your question there at any time. We'll be monitoring that and gathering questions that we can ask to our panelists after the presentation to the end of the hour. Do keep your chat window open as well, because we'll be dropping in some helpful links and resources along the way so that you don't have to scramble to write those things down either. We are expecting this presentation to last 1 hour. And jump over here. Next up, tip of the hat to Bobby Long at HealthBegins, who is managing the slides on the back end for us here. We can go to the next one. Thank you, Bobby. So our objectives for today, which are part of what brought you here, are to identify benefits and examples for social needs investment lab features, to understand how to use evidence assessments to assess and increase social needs investment, and to describe actionable insights and evidence on effective interventions to improve food security. That'll be our guiding example for today. Next up, please. So it's my honor to introduce our presenters today. From HealthBegins, we have CEO Dr. Rishi Manchanda, and from Elevance Health, Chief Health Officer Dr. Shantanu Agrawal, as well as Food as Medicine Director Dr. Kofi Essel. Welcome to everybody. Next up, please. And I now get to hand things over to our incredibly capable moderator, Vice President of Learning and Innovation at HealthBegins, Glasha Marcone. Glasha.
Thank you, Grace, and hello, everyone. We're very excited to talk to you today about advancing health equity effectively with the Social Needs Investment Lab. I'm Glasha Marcone, VP of Learning Innovation at HealthBegins, and we're really excited to dive a bit deeper today into our collaboration with Elevance Health, show you a bit about how you can use the Social Needs Investment Lab and what's coming next. So if you can go to the next slide, by the close of today's session, we hope that you will learn about the array of use cases for this tool and feel better equipped to invest in solutions that can improve population health outcomes. So let's get right into the introductions. Joining me today are two collaborators from Elevance Health, Dr. Shantanu Agrawal, and who's the Chief Health Officer at Elevance Health, and Dr. Kofi Essel, the Food as Medicine Director at Elevance Health, as well as the HealthBegins CEO, Dr. Rishi Manchanda. So I'm going to first go to Rishi to introduce himself, as well as HealthBegins and the guiding principles.
Glasha, thank you. And it's great to be with you, and Shantanu and Kofi, wonderful to be with you guys as well. And thanks to everybody at Elevance and on the HealthBegins team, and everybody who's joining for being with us today to talk about the Social Needs Investment Lab. HealthBegins, as you can see on the screen here, is a national mission-driven firm that provides strategy consulting, implementation services, programs, and products to help health plans, including those that serve Medicaid beneficiaries, as well as health systems and community-based organizations, to exceed the growing healthcare equity and social needs requirements and goals that I think we all share to be able to improve health and whole health, especially for patients and communities, and to do so in a multi-pronged way to achieve long-term impact for communities. We've had the privilege of working with a host of vanguard institutions, no less than Elevance, actually, especially when it comes to this topic. So I'm really pleased to be able to join you all today, and I'll turn it back to you, Lasha.
Thanks so much, Rishi. Shantanu, can you introduce yourself as well as Elevance and its whole health approach?
Sure, Glasha. Well, first, thank you, Rishi, for the partnership and the opportunity to speak to this audience today. I'll also thank my colleague Kofi, although he and I talk all the time. So it is really wonderful to be here. Elevance Health, core to our mission is our whole health strategy. And what that means for us is really making sure that we are assessing and addressing social needs alongside the physical health and behavioral health needs of our members. It's really those three parts coming together that we view as whole health and essential for driving improved health outcomes. Really, whole health is our answer to healthcare value and affordability. The Social Needs Investment Lab, Glasha, I got the slide is up, so I guess I'll speak to it for just a second. This lab is really the outcome of some work that we had launched internally first, and then frankly wanted to work with HealthBegins to make it available externally to anyone that would like to use it. So, over the last couple of years, we've really been using an evidence-based approach to better understand what interventions in addressing social needs actually work according to the latest medical evidence and data and science. And so we started conducting broad reviews of evidence very topically, for example, addressing food insecurity or nutrition insecurity, which we'll discuss today. And that evidence assessment really informed the work that we were doing as we've been working to build and create social need care models and programs. Towards the end of that cycle, we started asking, well, can't other stakeholders benefit from this? We are all in the healthcare ecosystem on this journey of working to understand how addressing social needs can fit into more traditional healthcare models. And so that caused us to reach out to HealthBegins and ask, could we make this available really as a repository publicly? And, we could imagine lots of different stakeholders using this, other payers, delivery systems, policymakers. The idea is to make this evidence available to all so that you can act on it according to your place in the ecosystem. And of course, there will always be this cycle of wanting to renew it and stay on top of the evidence. So, that is what we look forward to the repository really doing, this investment lab. And I hope it garners a lot of use.
Thank you so much, Shantanu. And Kofi, can you please introduce yourself as well as your food is medicine role and work?
Sure. Happy to be here today. So my name is Kofi Essel. I'm a community pediatrician by training. And here I am the inaugural Food as Medicine Program Director at Elevance Health. So for us, food as medicine, many of you all have heard the terminology, but the way we define food as medicine is that these are strategies or interventions that work alongside healthcare that give access to high quality, nutritious foods focused primarily on three things. How do we prevent? How do we manage? And then how do we even treat disease? Under that umbrella of food as medicine, we think about addressing food insecurity, nutrition insecurity, and as Shantanu's mentioned, diet-related chronic conditions as well. So that's kind of how we think about food as medicine. Food as medicine doesn't live by itself. It's not isolated. Food as medicine is a double click within whole health. When we think about the whole health of our members, food as medicine is one of the tools that we use to engage our members. So excited to talk more about some of the aspects of the lab and how food as medicine is really integrated well into that.
Thank you so much, Kofi. So to start, I want to just shed light on kind of the context behind the Social Needs Investment Lab and how it came to fruition. So Rishi, can you start by describing some of the challenges and opportunities in the ecosystem related to investing in the social drivers of health?
Yeah, thanks, Glasha. And I'll build on what Shantanu and Kofi kind of mentioned as well in terms of the origin story for this incredible project together. I think we're all aware that 80% or more of what drives health is based on what happens outside of the clinical setting. These are the social and the structural drivers of health. That HealthBegins, we talk about this, right? That health and the inequities between populations, for example, are all really shaped by social and structural forces that put some people in harm's way and determine where there's opportunities for people to live their healthiest lives. We know at the same time, because of this growing awareness, that healthcare and community-based organizations and across the ecosystem, from health plans to health systems, leaders are increasingly accountable for addressing health-related social needs, of integrating and working with community organizations to be able to improve health outcomes and to reduce health disparities and inequities. At the same time, though, it becomes, while it's really important then to make informed evidence-based investments in these types of kind of programs to address social needs, it can be really challenging. One of the things that we found in our work across the board is that institution to institution, leaders working in different complex and often varying business environments can find it difficult to be able to determine which interventions to address social needs are backed by evidence, and how to really glean the actionable insights from the evidence in an easy, accessible format. And so that's one challenge. There's another challenge, which is to be able to have the resources to assess all the social needs interventions. If you're in a health plan or you're in a health system and you're thinking about whether to invest, for example, to address food insecurity, say for looking at a medically tailored meal intervention or a program to support the building of a community garden or a food pharmacy, there's a wide variety of interventions. How do we assess these interventions independently and then together as part of hopefully a cohesive portfolio? That takes a space, that takes resources that are not only providing actionable insights, but also accessible spaces for conversations to unpack these insights and translate them into your own setting. And at the same time, last but not least, we know that a growing number of social service providers, including community-based nonprofits, are looking for ways to be able to understand the needs and the priorities of healthcare partners and figure out how to communicate the evidence and the impact of their interventions to address social needs. So these are some of the challenges that we saw across the board. And while there are really incredible resources more now than ever, and there's more research now more than ever on social needs, we thought it was important to come together to design a solution. And as Shantanu mentioned, to solve this need, we came together to create the Social Needs Investment Lab. We'll just shorthand that by calling it the lab. And this lab was created really in collaboration with Elevance and an incredible group of researchers and leaders at Elevance to provide this data in an accessible and actionable kind of form. So the first real deliverable, first real kind of offering, first real valuable product, if you will, of the evidence of the lab are evidence assessments, and those resulting assessments that we've already started to generate in areas around food insecurity, for example, and soon around maternal health and other domains are publicly available on the Social Needs Investment Lab website. And we hope that it can be the first of many resources that folks can use to be able to make sense of and to enhance their investments in social needs interventions.
Thanks, Rishi. Shantanu, during your introduction, you mentioned that this was an initiative that started at Elevance and that you really sought out partnering with HealthBegins to make it available to the public. And, given kind of building off of what Rishi just shared, is there anything else you want to add about, the catalyst behind this initiative, why Elevance really took the lead on developing it?
Yeah, thanks. We really started from the vantage point of, all right, if in order to really act on our whole health philosophy and model, we needed to do better to more comprehensively address the social needs of our members. But there was this knowledge gap, right? I mean, this is a few years ago, and while we've been talking in the ecosystem about more social needs care, and it's getting more integrated into, frankly, all of the work that we do as a payer or in delivery systems or elsewhere, I would argue that we're still relatively early in terms of knowledge generation, and even more so that knowledge getting out and becoming widely known in the ecosystem. And so we started down this journey asking, what is the evidence, just like we would in any clinical area, right? If we look at a diagnostic, if we look at a procedural intervention, what is the evidence that it works, and in what circumstances does it work? What are the impacts that it produces? We took a similar approach to assessing social needs. We looked at the literature, we looked at publicly available white papers that may not be in the peer review literature, and really put them together around certain topics. I think what's important to keep in mind, again, is this is point in time, right? So this is the best evidence that we have today, looking at the sources of information that were available. Second, we looked at outcomes broadly. So I know for many different kinds of organizations, financial return will be relevant. And we do include those data when available, but we also looked at quality outcomes and other kinds of outcomes that could matter. so that the lab is providing information that could be relevant to a host of different stakeholder types. So as Rishi was mentioning, there's information on medically tailored meals. We provide medically tailored meals to our members in part because of the work that we did to understand the evidence behind it. And those meals do improve financial return in some cases. They help with quality improvement. They help with readmission reduction. And so clearly move metrics that matter to an organization like us. If you look at something else like a community garden, that is less studied in terms of specific clinical outcomes, but the impacts that it is able to produce on a community may well be relevant for a community planner, a public sector employee. So we didn't want to wall off any of the information. I do think it'll be useful to different stakeholders, perhaps at different times. And again, I'll remind the audience, it's point in time. So if there's a paper that you think is missing, we certainly want to hear about it. But it reflects the work that was done to that point.
Thanks, Shantanu. I'm gonna move forward by really diving into who we built the lab for and why, and diving a little bit deeper into the user profiles and example use cases. So first, who should use the lab? Like you mentioned, Shantanu, like you mentioned, Rishi, the lab can be useful for anyone with the responsibility for improving individual and community health through addressing the social drivers of health. So these can be market leaders and chief medical officers at managed care organizations, community health leaders at healthcare systems, benefit leaders and chief medical officers at employers, community-based organizations, and social service providers. And to get a little bit more granular on, why someone would come to the Social Needs Investment Lab site and explore the evidence assessments. If you go to the next slide, Bobby, we can provide a couple examples. So an example here is, as a hospital community health leader, I want to identify all of the interventions for addressing food insecurity so that I can choose which intervention will work best for my population and context. So at this point, Bobby, I can actually take over the screen. I'm going to go to the website and just show you how you can use the tool to do that. And then I will also just share a little bit more detail about what you can find on the site. So as you can see here, when you go to the Social Needs Investment Lab website, it lands on the evidence assessment library. Here are the evidence assessments. And so evidence assessments, like our guests mentioned before, are a collection of studies and the synthesis of those studies. So rather than posting individual studies, we're really trying to say, what is the body of literature telling us about this intervention? You'll see here several filters. So for example, if I want to explore all of the food insecurity evidence assessments, I'll select food access. And so I'll see the various evidence assessments for those specific social drivers. You can also look at geography. So which studies actually looked at, urban populations or rural populations. You'll see that most actually considered both geography types as well as payer types. So you can get a little more granular into which interventions and studies actually looked at conditions similar to yours to help kind of drive the decision-making on your part. I'm just going to go into, an example assessment. So we really try to provide what we call the bottom line upfront. So we want to give you, kind of signal and direction of whether there is sufficient evidence that a certain intervention works and what the impact is on these outcomes: health, cost, utilization, and value, health, and social outcomes. You'll see the table of contents here that we provide. First, the synthesis or the assessment. We go to the background of the need and the impact on health, the background on the intervention. This is where we have the detailed evidence review, so it shows every study. And then we get to our assessment criteria. So this is really important for us to, explain why we chose certain studies and how we evaluate whether there is sufficient evidence, strong evidence, or mixed evidence. I'll also share that we provide all of that information on the About the Lab page. So you'll see, details of who should use it and why, but also the study inclusion criteria, and then the description of the outcomes we look at, as well as the rubric for how we categorize the strength of evidence. So hopefully that's helpful in kind of understanding how you can use the tool to really find out, the breadth of studies and the breadth of interventions to then narrow in on what might be most helpful for you. And I want to move to another potential, use case. Let me just share the next one here. So another example is, as a medical director for a managed care plan, I want to quickly assess the evidence for a specific program or intervention. So for example, medically tailored meals, so that I can understand the impact on these outcomes and decide whether to invest in an MTM program. And so to explore this example a bit more, I want to hand it over to Kofi, who can really walk us through, from the perspective of a food as medicine director, from a medical director perspective, the types of questions, that we're asking and want to find out, and how the lab can help answer those questions.
That's a great point. Let's frame this first for those who don't know. So food is medicine, the concept we've talked about. Typically, we talk about 6 main approaches that we use to address food insecurity, nutrition insecurity, diet-related chronic conditions. People know sometimes as a food is medicine pyramid. At the apex of the pyramid, the intervention that is sort of the most poignant, the most directed towards health conditions is what we call medically tailored meals. Medically tailored meals are pre-prepared meals designed by a chef and dietitian, designed to give you 50% or more of your calories for the day. They're delivered to the home typically, and they're ready to heat and eat. You either store them in the refrigerator or store them in the freezer. People are seeing these pop up all around the country. There's a lot of interest and excitement around them. But one of the questions is simply, does this work or does it not work? And then what do you do with that knowledge, right? So actionable insights is key. So when you say, I'm a healthcare institution, I'm a payer, I'm trying to, work with a state and give them the evidence of why this is something we should continue to move forward on, I need the evidence to be able to make that argument. So I can come here to the lab and I can simply understand in those 3 categories. Number 1, healthcare cost, utilization, and value. Number 2, health. And number 3, social value. When I think about those 3 concepts, we know in the criteria that we've used for this, we use 3 main categories. 1, is there strong evidence to move forward? Number 2, is there sufficient evidence to move forward? Or 3, is there we need more evidence or sort of a mixed evidence around this? So these 3 categories tell us a lot. So when we look at these 3 different criteria, we see here for healthcare, cost, utilization, and value, we see sufficient evidence, right? So again, this is big picture executive summary kind of detail. Sufficient evidence, health, sufficient evidence to understand that there's impact using MTMs for health outcomes. And then for social outcomes, we see here sufficient evidence as well. You say, hey, I want to understand this a little bit more deeper. I look here at health and say there's some connections between lowering mortality, decreasing A1C, reducing paracentesis, maybe some improvement in HIV viral suppression. Okay, so that's a little bit of an understanding. But what I really love about this tool, if we can scroll down a little further, you can see, as Glausha mentioned, there's some good background information, some keywords. If we can scroll down into where the magic really happens in the table of contents, this is where I think can be incredibly helpful. The table of contents really breaks down these articles that we're talking about. Again, we've given specific criteria. These are more recent studies that have really shown us some interesting insights into these different categories. So here you can see some of the most relevant studies in this topic that are broken down and give us a good insight into the population, some of the incomes and the outcomes around costs, around health outcomes, around social outcomes as well, all clearly defined here. The other thing here is that there are hyperlinks on the left side that you can click and go directly to those articles as well and dive deeper. Oftentimes, myself with my colleagues, we have to pull this data together, right? When I was a researcher on the ground, we had to be able to pull the data together to apply for the grants. Working with the CBOs, they needed to be able to make that argument. Where is the data around this? This is where the data is. It's very existent, it's very available and palpable. You can pull this out and help you to build out your narrative, to tell your story, to make, again, actionable impact. And that's what we're trying to do here. And that's an example with medically tailored meals.
Thank you so much, Kofi. I wanted to just share that we're releasing evidence assessments in batches. So what you'll see to date are evidence assessments on the social drivers of food access and maternal health. Every month we're releasing more. As you can imagine, there's a lot of studies that we want to go through. We have a very thoughtful and time-intensive process to really evaluate the studies and synthesize them. And so you'll see more and more evidence assessments being released. One of the best ways to stay up to date is you'll see this contact form here. If you sign up, we will email you first every time there's a new batch of evidence assessments released. And the other thing you can do is actually request specific topics for evidence assessment. So we really want to be driven by what we're hearing from the field, what you really are looking for evidence and synthesis around. So really appreciate all the folks who have already done that. All right, so I'm gonna pause sharing for a moment. I know we have a lot of questions coming in, and before I go into the questions, I wanted to ask Kofi, you went into like the specific example of medically tailored meals. I wanted to ask, what are the other like most promising interventions or programs that you're kind of seeing evidence for in the food as medicine field?
Wonderful question. So, one of the things around food as medicine, again, these different categories, I think there's a lot we have to explore. There's a lot we know about food as medicine when we look across the board, but there's still a lot of questions we're asking. We know enough to act on some of these things, but we want to ask these questions and explore as we grow in this space as well, within our company and also externally as well. So some of the areas that we think about in terms of how the evidence is growing is around produce prescriptions, right? So there's been a lot of rich data around produce prescriptions, the effectiveness of them, how long you should be doing produce prescriptions, what is the right produce, how should we be thinking about this, what are the right populations and the disease states that we should be working with, where should we be getting the food from? All these are great questions that are in the literature that we're pulling together. So around produce prescriptions, around medically tailored groceries, right? When we think about items that are not just medically tailored meals or produce, but other items as well, whole grains, nuts, seeds, legumes, how these things fit into individuals' culture, into their lifestyles. This is a really important question. We ask a lot of times around government nutrition security programs, SNAP, WIC, school meals, CSCFP, the list goes on and on. Are these programs effective? Do they improve health outcomes? Do we see social impact? Do we see utilization improvement, cost improvements? These are questions that we're asking. And honestly, in working alongside a number of partners around the country, people are wanting to know the answers to this and want to figure out where the data is coming from. So we ask questions around that as well. I cannot leave out our local amazing partners, our food banks, our food pantries, our soup kitchens who are doing amazing work, really partnering well with them and understanding where their evidence is around those interventions as well. And last but not least, nutrition education, right? Medical nutrition therapy, culinary medicine, recipe tools. How are these digital tools being used? What is the evidence around them? And how can we implement them to make more impact in different populations that we work alongside? These are some of the areas that we're exploring. These are some of the areas that are really exciting in the food and medicine space.
Thank you so much, Kofi. Rishi, I have a question that came in through Q&A that I'd love to direct to you, but other panelists feel free to jump in. Can you talk a little bit about how this lab compares to PCORI and the Commonwealth Fund evidence libraries?
Yeah, and I'll also speak to, thanks, Clash. I'll speak to, I think another question that I saw come in related to some other evidence resources that are out there, including the Health Evidence Guide. that some are referenced. And I'll also add that there's another really invaluable resource alongside those that you mentioned, like PCORI's, like the Health Evidence Guide, like the Commonwealth Fund's kind of evidence repository. And that's the evidence that we see compiled from our friends at Siren, the UCSF Center. What's important to note is that as we were talking through the challenges that many in different healthcare settings were facing, for example, a medical director making important choices within a health plan, or a leader directing health equity efforts within a health system. One of the things that we found was that the ability for those individuals, right, making business decisions, looking for information about how to inform their allocation of resources, to be able to really improve whole health, to improve health equity, to drive the mission of the organizations forward. What we heard time and again was that they found a lot of the research evidence databases and curated resources like the ones described over here very, very helpful, but those are really designed primarily for researchers and policymakers. If we look specifically at some of the really great resources mentioned that are incredibly invaluable to be able to go deeper and understand some specific studies for a specific set of interventions, most of these evidence resources that are currently available really compile the research and communicate and make it easy to find a specific set of research studies thematically organized. But how do we then answer the question in a time-sensitive way for someone who is a busy, not a researcher, but those who are working in these kind of healthcare settings, looking at how to allocate the resources? How do we then distill down, synthesize the latest evidence for a specific intervention, medically tailored meals, as Kofi mentioned, or another set of interventions? That's what we see as additive here with this Social Needs Investment Lab, to be able to help collate, synthesize the evidence base that exists up to a point in time, as Shantanu mentioned, and then to be able to make it easier for those who are working in these settings to be able to access actionable insights from that research. So rather than looking for the individual studies, study by study, and trying to make sense of it, we're leapfrogging that process to make it easier to understand how to glean the actionable insights over in those key outcome areas, as you mentioned, and then be able to point people to their studies, as you showed in the walkthrough, Glasha, so that folks can go deeper into specific studies and then link to those invaluable resources like the PCORI, the Health Evidence Guide, Siren's database, and others. So that's one major distinction. The other is that these evidence assessments are up to a point in time and a continuous process. This is a library being built rather than the library that is done, right? And I think that's because the evidence, of course, is emerging, as Kofi, you mentioned. So clearly it's emerging so rapidly. It puts a fine point on how to come in and help provide some synthesis to inform and make it easier to get actionable insights. The other is that actionable insights have to be relevant for the setting, for those making important decisions about where and how to allocate resources, which means taking into account factors beyond what is sometimes included in the research study or a set of research studies, such as what does this mean now for this line of business, for this population, for this state environment, for these kind of priorities that we have. That's where the evidence assessments serve as the first element of the Social Needs Investment Lab, but also tee up what we are excited about seeing coming soon as well, which are the convenings to bring together stakeholders to talk about and share their notes. So the evidence assessments that we're highlighting today are not the only element, but a foundational element of the lab. So I'll pause there and see if Shantanu or Kofi wanted to add anything to that.
I think it's really well stated, Rishi. And one thing I'll thank you both, you and Glasha and your team, because it's actually a pretty usable, user-friendly repository, the lab. And I think that's really important. So being able to show some of the power behind it, we want people to be able to segment these studies and the data by different populations, geographies, et cetera. That's really important. And I know it will mature and build out over time as we add more evidence assessments. Maybe the only thing I can add, Rishi, to what you said is this is meant to be a very practical tool. And so I don't view it as being competitive with anything else. By all means, all of the resources that you identified early on that was in the question, those resources are fantastic. We encourage people to go to them. We took, as we were assembling the information, we took a very practical lens, asking what should we do? And if we're committed to a particular route, how should we get it done? And I really hope people feel that that very practical flavor is embedded in the assessments that they read, because that is kind of what we needed in order to move the ball forward and implement programs for our members. So I hope it's equally useful in that very practical sense for stakeholders that take advantage of the lab.
Thank you, Shantanu. I see a couple questions related to how to let us know that you're looking for evidence assessments on certain topics. So first is, you can always feel free to email me. I'm glasha@healthbegins.org. I love feedback from folks and take it very seriously, so please contact me. But also there's this contact form. So we have an option here of suggest an evidence assessment topic and or study to include. So this is a great way where I'm kind of collecting all of this information in a specific area. And also this includes, you know, any kind of feedback. So I'm seeing in the Q&A some suggestions for the product as well. So again, really welcome those suggestions, and more likely than not, I'll reach out and have a conversation with you about it just to better understand, because like Shantanu mentioned, you know, we really prioritize a friendly user experience, making it really easy to use. Yes, thank you in advance for that feedback. I also have a question here about how we really weigh evidence and what standard of evidence we require in order to inform action. So I know Shantanu and Rishi, you both have some thoughts around this. I would love for you to share.
Do you want me to go first, Shantanu? Would you like to?
Go ahead, Rishi, I'll add on.
Thanks. I think, Glasha, first, it's worth reiterating, I think, what you shared in the walkthrough, which was on the website, there is, and I'm not sure if you're able to share it on screen now, just to orient folks, again, to some of the transparent discussion about the different criteria that were used and the ways in which evidence was discussed. I think it was on the main page at the bottom. Yeah, thank you. The study inclusion criteria. So we do include, and I think it's important, instead of reviewing each one here, to let folks know that they can look at this more closely so they can provide feedback or answer any questions they have about the criteria used for inclusion. There's another element as you scroll down, as Glasha mentioned as well, that speaks to the ways in which we were organizing the evidence into categories around outcomes. And then lastly, how to assess the strength of the evidence that's available for each intervention. I want to pause here, and maybe this is a baton pass, Shantanu, to you and Kofi. One of the things that I really find powerful about the promise of this, and we're already seeing this now with some of the initial batches of evidence assessments, is that while there's a tremendous amount of research, both published, you know, in the academic literature as well as the gray literature, you know, the white papers, et cetera, there's a tremendous amount of research that often will speak to one set of outcomes, health outcomes, or perhaps utilization. And what we found is that that is invaluable information, but the contextual information that those who are responsible for, you know, implementing healthcare delivery or helping facilitate through payment, you know, access to healthcare, the additional information is about the economic information, right? Cost effectiveness, financial, as well as, of course, the social, increasingly important, of course, and relevant for social needs interventions. What are the social impact? Because, of course, food has intrinsic social value, irrespective of the potential benefits for health or healthcare. And so what we've found here is that it's important to identify the different outcomes here. And in the process of organizing the evidence assessment library in this way, also send a signal to the broader ecosystem to say that those making important decisions about how to allocate resources to be able to drive whole health and to advance the mission for organizations need to see from the research community and need to inform the kinds of questions that can help fill in the relative gaps in the research and public, published research, the gray literature as well. Business leaders need, right? Healthcare leaders need more information on the impact in these other categories. And so I think it's an important element of what we have to date, but also a signal of what we hope to fill in over time as we craft this library. Shantanu, does that resonate?
Yeah, I think it's a great comment, Rishi. So, it has been important to us to not prioritize one outcome or set of outcomes over the others, because I think that would make the lab perhaps less useful or just more focused in its use. So affecting healthcare utilization is clearly important, but we did not, a priori prioritize that over other health outcomes or other social outcomes. This is more about trying to be as transparent as possible, and in our, let's call it assessment or judgment, right? So this is, I think we need to keep that in mind, that this was a, committee's view of the evidence. But what we really tried to do was judge the rigor of the evidence and not prejudge the outcomes of greater importance. And so, we will see, and I think just by virtue of the fact that this is a quote unquote younger field in the sense of rigorous trials coming to social needs care delivery or the social care model, it's just earlier on than, let's say, cardiology or pediatrics or gastroenterology. We wanted to bring a similar quote unquote clinical view, again, prioritizing evidence, but recognize that we will often need in these areas just more time and more studies to be done. But again, at the same time, we didn't want to water it down. So we are very clear. Look, there's strong evidence here, and a lot of evidence assessments won't reach that level. And I think that speaks to the relatively earlier stage this particular field is in. But there are, and this is the good news and the important news that our leadership and policy leaders and others need to hear, there is sufficient evidence for a lot. So let us not place social needs care delivery on a higher bar than other areas. Let's make sure the bars are equivalent. And then let's just be clear on what works. Because I think all of us, certainly on the webinar, including the audience, we want things that work to be implemented. And we want continued trialing and experimenting where the evidence may not be clear. So that's why we try to be transparent on all of that. But again, main message, this is not about prioritizing one outcome or another. It's about giving transparency to all of the outcomes that are possible so that the reviewer, the reader of the information can decide for themselves what is most important for their enterprise.
Can I highlight an example, if possible? So I want to build off of that term transparency, right? So if you look over the last decade, you see a number of different professional organizations highlighting the importance of identifying individuals who are experiencing food insecurity and then intervening, right? So American Academy of Pediatrics, family physicians, internal medicine, at the VA, they're universally screened across the board. Our dietitian colleagues, our nurses, ADA, American Diabetes Association, everybody's saying we should do this. So you would expect the evidence is strong evidence, right? The association with screening and intervening for these health outcomes or to show utilization improvements should be strong evidence. But if you look at that assessment, you're not going to see strong evidence. And it's not to say it doesn't work. It's not to say we shouldn't do it, but it is to say where we are right now in the literature is that we don't have enough evidence. A lot of our evidence is really process outcomes, looking at the processes going on, qualitative assessments. These are really great, but we need more evidence to be able to do this more robustly. And that's something that we need to fill that gap. And so it's a good question. And it's a good question that we send out to the world to say, hey, how can we fill this gap a little bit more effectively? Not how do we eliminate it, but how do we fill that gap more effectively? And that's an important piece that we want to keep in mind as well.
Glasha, can I build on that? Or maybe I'll ask you.
Absolutely. Go ahead.
Just to really appreciate that point, Kofi, and I think that, there's another element of it that you're kind of unlocking as we're talking about this together, and as we've been planning this and putting this together. In some cases, there is a lot of evidence for certain interventions, be it in food security, and as we're going to see as the evidence lab, as the evidence assessments continue to come for other domains, housing, and so on. And sometimes the gulf between what we know in the evidence base and what we're seeing in practice is pretty big as well, right? And so we don't see enough of an uptake of what seems to be a really powerful intervention judged by either health outcomes, healthcare utilization outcomes, and/or social outcomes. Part of the reason we've seen in our conversations with a number of folks who are working in day-to-day busy environments, including those stakeholders you mentioned, Kofi, like the RDNs and the medical directors and the nursing officers and the social workers, many of whom have different formal responsibilities for kind of leadership in their institutions, be it health plans or health systems. It's really hard to kind of run day-to-day operations and then have to go and figure out what to make sense of in the evidence base. So this is an attempt to try to help close the gap and make the evidence for social needs that is rapidly emerging and evolving, as you said, and still needs to go further, as you both mentioned, to at least close that gap so it's easier to have those who are making important decisions about how to allocate resources for health to understand how to accelerate that. The other thing that I think is really key, and this is going to something else I saw in the kind of Q&A, is that this is the Social Needs Investment Lab, which includes this evidence assessment library. And I want to really unpack really quickly why that distinction matters, at least to the way that we were collaborating and envisioning this. Because it'd be one thing if we put out a library, right, of evidence assessments, and then alongside other really wonderful kind of resources, hope for the best. What we're seeing in practice from the feedback from a lot of individuals, really specifically, is that the kinds of synthesis of evidence that we're seeing in these evidence assessments are necessary, but may not be sufficient. We also need to see, like some folks have asked in the Q&A, hey, to be able to help now evaluate an intervention, are there additional tools? If I want to come into a space to just share notes with somebody else who works in a similar setting across a different state, how can I come together to talk about this evidence assessment? If I want to understand how to present the case about the blended value, including health and social and healthcare kind of outcomes for this, how do we talk about that? What does blended value mean, right? In other words, the lab is a space to do exactly that, right? To come together and share notes, to test ideas, to learn from others. And the evidence assessment library is just the first major kind of element within that lab to inform that. So I want to really underscore that because there's more to come. One last kind of concrete example I'll share. I received a note last week from someone who saw some of our food security evidence assessments working in a large health system, and had actually taken the evidence assessment for a specific set of interventions, and then forwarded that link to several colleagues within her own health system. And she said that it sparked conversations within her own health system about something that had long been discussing but hadn't really coalesced around. So it's not just for individual use, right, to understand these insights. It's meant to actually be something that people can rally around and then catalyze more investments more wisely and more effectively.
Thank you, Rishi. I wanted to share just one more example and kind of give you a preview of what's coming next. And before I do that, I'll just answer a couple of questions around, what's available on the site today. So as you see, when you go on the website, there is just the food access and maternal health social drivers available today. So yes, that's correct. Again, we're releasing the evidence assessment in batches. So coming up next is going to be housing and then transportation. So the best way to get alerts on when these batches are released is through the contact form on the website. So we're excited to be releasing those soon. And again, you can also request topics, based on what your needs are, and we're happy to respond. So before I ask the next question, again, just want to share a quick third example. So as a healthcare leader, though, of course, not limited to healthcare leaders, you may be a leader in a community-based organization or a social service provider. I want to connect to other stakeholders so I can learn from their experiences investing in social needs to gain insights into best practices and develop partnerships for implementing programs. So the Social Needs Investment Lab is not just a website and kind of a database or repository. We're actually going to be facilitating these types of partnerships and gatherings through our upcoming convening. So again, signing up on the contact form is the best way to both indicate interest in participating, but also, get alerts as we share those. So to get back to our panelists, can you expand on some of the other use cases for the Social Needs Investment Lab, specifically how to use these tools to build business cases or to foster partnerships?
I wanted
All right,
to
maybe I'll.
Yeah, please.
Oh, go ahead. Sorry, Rishi.
No, I was going to tee you up. Yeah, please go ahead.
I'm happy to start, and then please feel free to add. So I do think both at the top line level, right, like just understanding what health outcomes, or social outcomes, or other outcomes can be driven by an intervention is useful. I do find, I mean, Rishi, you provided a great example. Even circulating data inside a company helps to make a difference, right? There are often presumptions that people can have, especially if they're not well aware of this space or experienced in it, about, there can be an assumption about limited impact, or, hey, does this really work? And the answer can be yes. And there's a published literature that supports creating some kind of intervention program. Here are the outcomes that can be produced. I think the more meta-analyses and other analyses we have that we can put on the lab, the better off we'll all be. I know we'll get there one day. But I think being able to share that is often a useful tool for guiding strategic thinking and direction. And then look, nothing gets away from doing the work. We've tried to do a lot of the work. Health Begins has tried to do a lot of the work. But at some point, you may well have to dive into the papers. And that's why I think it's really important that the links are provided. So there are some great questions about, hey, how do we know what specific populations at a highly granular level were included in a study and the outcomes that were produced? That's a really relevant question. And that is the kind of thing that probably will start with the evidence lab, but ultimately get to the papers that were at the root of the evidence assessment. So nothing will really replace that, I think. But I think the business case kind of exists in that continuum, right? So we often think about, hey, what are the macro level populations in our own enterprise that we can move the needle on? Maybe it's the Medicaid population, the duals population, et cetera. The evidence assessments, I think, are quite helpful for that. And then if you really need to get to, yeah, but does it work in Kentucky for a duals member living in a rate? All right, you're going to have to go to the papers for that. I don't think there's any getting away from it. But the good news is these are published papers. They are often quite detailed in the populations they looked at. And so if the case needs to get there, I get it. But I think at the top line business proposal level, the evidence assessments, I think, are that's sort of their sweet spot, because, again, that's how we utilize them internally. I don't know, Kofi, Rishi, please feel free to add.
I fully agree. I think that's the way. That's a great way to think about this. I think when I think about how we work with different partners around the country, I think it comes down to simply that question. We want to make an argument for why this is something we should invest in. Is this something that we should put effort towards? Where is the evidence around that? In lieu of services, 1115 waivers, these kind of the language there, right? Like, where's the evidence behind that to make the argument to actually run this kind of intervention? The evidence is here. And not only is the evidence here, but what do you do with that evidence? Actionable insights with that evidence. I think that's key, and that exists here. I love what you're saying, Shantanu. Sometimes you got to open that article and take a look, if not behind firewalls. But at the end of the day, we've done a lot of that heavy lifting for you to really start that process and, again, help you to build that narrative. And that's really important.
Yeah, I really love that. I'm going to add and maybe come at it from a different angle to kind of highlight just yet another kind of, I think, potential benefit for this that in some cases we're already seeing some feedback on. There's the catalytic kind of potential for this, right, to help catalyze and accelerate business decision-making, understanding within unique settings about social needs. There's also a large number of organizations that we know are already doing the work, as you both said, who are already investing in allocating and supporting through grants or direct kind of funds, social needs interventions, be it in food or housing. This is an opportunity then to help to collect from those ongoing continuous improvement kind of projects, collect the information from those who are practitioners so that they can share with other practitioners in a lab setting what they did. We all know so many stories exist when we're in a conversation with somebody within an organization and they share, well, in our quality improvement project to address food insecurity or improve diabetes, we found A, B, and C. That may or may not be translated into a published academic study, right? And yet that experience, especially in the context, in that setting, a set of populations, is invaluable knowledge. And so this is another use case is to let the evidence assessments be the beginning of a conversation, but also to be able to use that feedback form that Glasha put on the screen there to share your own evidence. People are generating evidence every day on the front lines of healthcare in America and in partnership with social service organizations. And yet that evidence doesn't get often translated into some of the published research, and yet can still be invaluable for us to learn from. The lab is a space that we hope will allow for the sharing of that information as well.
That's a really great, important point.
I was just going to say this, that is such an important note almost to make sure that it just really gets driven home. Look, I think affecting social needs is a huge mission for any organization. And we're a big company, but really to meet our aspirations and probably meet the aspirations of all the people watching, it means working together. Part of working together, I mean, that was a major driver for this. It was to share knowledge, to share what we knew so that other organizations and individuals could be part of the effort. I think, Rishi, what you just said is so important. There's a ton of work happening out there. Some of it does get published. A lot of it, frankly, doesn't. I would love to see more of it being shared and for this lab to be organic and living and kind of accruing all of this knowledge so that, again, we are all aligned on what is possible. We are all aligned on what is doable. And then we can spend more of our time on actually getting the work done.
I think that's a beautiful note, Shantanu, to start wrapping up this conversation. We didn't get to all the questions, but just know that we have been recording them and we'll address a lot of them either in the follow-up or again, please don't hesitate to reach out because all of your questions and ideas are really valuable and I think actually touched on these last few points that we just discussed. One thing I want to note, one of the questions I saw was around how often the evidence assessments are updated. So we update them at least annually unless we see a new study come out, in which case we prioritize, updating that specific assessment to incorporate that new study, but at least annually. All right, so I think that we're going to wrap up here. Thank you again to Rishi, Shantanu, and Kofi for not only having the idea for and helping create the the Social Needs Investment Lab, but also for sharing your thoughts with all of us, kind of walking us through the history and where we're going in the future. So I'll pass it over to Grace for next steps.
Thank you so much, everybody. And we really hope that this is the beginning of this conversation. So you see here a number of next steps to help us continue moving that forward. So when you sign out here, you will receive a survey that pops up for you. We would really, really appreciate your feedback on that. Also, please share your favorite moments and insights here or resources, thoughts that come up for you. You'll see our social media handles for HealthBegins there in the chat, and stay engaged. The link to the Social Needs Investment Lab and the contact form for that will be going out in the follow-up email. That's where you can sign up to continue receiving updates when new material becomes available there. We also, do we have a next slide? Or is that our last slide? There we go. At HealthBegins, we have one more webinar coming up in March where we would love to see you making the case for housing as healthcare. There were a number of questions in this hour about medical legal partnership, and so that may be a place to address some of those. And with that, we really appreciate the work of all our panelists and our host here and all of you as participants. And we hope to see you all again very soon.